people that are directly employed by TUSLA, through social work or social care or family support workers, and also the commission services, you are dealing with a lot of trauma, and you're every day you're working with a lot of people, but families with a lot of complex needs, and I just wonder, I suppose, like we have I suppose Ireland, we have like the weakest workers' rights in Western Europe, and I think, and this is in a broad spectrum, I suppose, and I'm just looking at that. TUSLA as an agency of the state, is there a possibility that through commission services, but also when you're contracting out services, say occupational therapy or even residential care, any of the private services, could there be a condition that that people, that whoever's getting these contracts, that they have to ensure that there is a protection of workers' rights, like the right to collectively bargain, but also not even that though. I think therapeutic support for staff is a huge gap within definitely commission services, that a lot of managers, we'll say, in services would have they would have worked on the ground themselves, and then that there was a progression route, they became managers, but there is definitely a lack of therapeutic support for frontline staff, and I think that's an area that is definitely can be looked at, and I suppose I know that myself from working in the area, that you are I suppose working with people that are dealing with a lot of trauma, and that does rub off, there is an impact. And I'm wondering, is there any way that can be budgeted into any kind of both commission services and direct staff, that there is nearly mandatory, I think, therapeutic support for frontline workers?
I might let maybe Rosario start with that, and then Jerry, and anything he wants to add.
Thank you very much, Deputy. And of course, we absolutely value the work of our voluntary and Section 56 in particular. In relation to having mandatory diktats, I suppose, in terms of health and well-being or whatever, I don't personally favour that. I think that it's more an approach, it's a way we work. Now, as I said, what we have is our people strategy, and again, people can glaze over when you talk about a people strategy, but it is absolutely fundamentally important. We are a people-delivered service. It has to be all about the people and getting that right. We have improved, I would think, a lot in terms of providing that psychological support, those interventions. For instance, within TUSLA, in terms of that pillar, it's a work pillar, trying to develop a culture of health, which is not easy and crucial. We have put in psychological supports for staff, for our frontline staff. We have our CISM approach, with that is critical incident stress management. Again, a full programme of work around that. Now, I am more than happy to engage with any Section 56 provider who want to partner with us or take what we have and utilise it, rather than you paying for something like that as well. You're quite right. The work is emotionally draining. It's emotionally taxing. And just by way of information, I was looking at the top 5 reasons for referrals to our occupational health and our employee assistance programmes from our own staff. And the top 5, number 1, stress, anxiety, bereavement, depression, and relationship difficulties. So, of course, we have to get in and support the staff. I'm confident, as I said, we are doing better. Very happy to partner with you if you want to have any access to any of those resources.
That's very welcome, and I think that often, I suppose, voluntary community sector, or definitely commission services, you're struggling on a tight budget. So even and managers, like the fantastic managers, but often they're not trained in therapeutic management and not even reflective practice. But I suppose that therapeutic, basically psychotherapy support or counselling support for a lot of staff.
Absolutely.
And so I wonder again, would well-being of staff, can that be factored in to to annual budgets? Not necessarily, maybe TUSLA direct staff is different, but again to the commission services. But can that be factored in, that the actual well-being of staff, it can be factored in as
it could certainly be a
necessity, as essential.
Yeah. Senator, if I could come in just because I know of several examples, and I think and to be fair to People in Change and the strategy under People in Change, one of the big positive changes I've seen within TUSLA is that when somebody is going off sick, that there is good engagements with those individuals in terms of trying to get a return to work plan that looks at the full reasons behind the sickness absence and actually a range of supports. There's nothing that I've ever seen that has been turned down in terms of supports to a member of staff to help them return to the workplace. I can't think of anything, and anything that I've been asked for, it has been provided. And that's almost like a psychological contract, with the worker. to ensure that they get back quickly. And we all know in terms of therapy and intervention, the longer you're off sick, the less likely you are to come back. Yeah. So that constant engagement from the moment of the sickness absence and indeed on return to make sure that that staff member is getting whatever individualised supports they need, but also peer support. Yeah, and it's a cultural thing as well. It's about the culture of management and the culture of care for our staff that we need to constantly pay attention to and develop, and particularly in an organisation where we're struggling to get certain grades of staff, that those supports are really important. Yeah.
And I do think also that I think it's important to recognise certainly what we've heard from our own staff through various different forms and initiatives. Some of the changes that are required actually are not about funding. They're about space, they're about time, they're about leadership, they're about a commitment to, as Rosario said, a healthy culture within an organisation. And certainly I know now that you've raised this with us, we'd be more than willing to do an event or a session to kind of support, community and voluntary organisations if they wished to come and kind of hear directly from us in terms of what we've found beneficial, and also, as Rosario sharing what we have, if that would be of any help. And I also do know there are lots of community and voluntary sector organisations across the country that you do see that they're putting very good supports in terms of their staffing. So it's certainly something I think that we will take away and look to see. As we obviously have, we have a commissioning advisory group, and that's the group that we have in the place in Tusla that allows us to engage, kind of once a quarter on those kind of strategic issues with Commission services.
Thank you. Because I think